We're joined now by infectious disease expert, that's Dr. Celine Gounder. She's also editor-at-large at the Public Health at Kaiser Health News. Good to see you, Dr. Gounder. Boy, help us sort this all out. There are a lot of people that are cheering, as you saw on the plane, saying it's about time. Still others are saying this makes no sense. What do you think? Is this a good idea to lift the mask at this time?
The CDC had delayed lifting of the mask mandate on public transportation, including airplanes, just for another 2 weeks. Right now, we're waiting to see how this new BA.2 variant, this newer subvariant of Omicron, how that's going to play out across the country. And if it turns out to be pretty mild, the CDC was planning to let those mandates expire. I am concerned that we just don't have quite enough information yet, and another 2 weeks was really the appropriate cautious approach here.
And what about people that have, highly compromised immune systems? What does this mean for them?
We are now in a phase of the pandemic where we have put the onus entirely on those who are immunocompromised to protect themselves. That means that we need to make sure that they have access to high-quality masks, the best masks possible. So that would mean either an N95 or a KN95. The other thing to remember here is that many immunocompromised people don't even know they're immunocompromised. Many Americans are obese and have type 2 diabetes, which causes a milder form of immunocompromise. And many Americans do not have primary care doctors, insurance, and so may not have that diagnosis and know that they should be taking extra precautions.
Listen, I know we're all sick of wearing a mask. I don't know anybody that likes to wear a mask. The other day I was on a plane. I tried to drink and forgot I had my mask on. That's how I've gotten to wearing it. But do you think that this ruling should be appealed, or should we all just move on, in your opinion?
The real question here is, what does this mean for the CDC's power to reimpose a mask mandate? Say if we have another big surge next fall or winter, or say we have another pandemic. And so I do think you are likely to see this decision appealed to preserve those CDC powers for that what-if scenario.
And what do you think about a what-if scenario? Because we're still not out of this. Don't you think there's still more to come with this pandemic and COVID in general?
Yeah, there's certainly more to come. We know that this is a virus that mutates. In fact, it's mutating very rapidly. We will see more variants, and we will see other pandemics after COVID. So I do think the idea of stripping ourselves of an essential tool in the toolbox is a really bad idea. I think we do need to have that option at our disposal if we do face another crisis.
All right, Dr. Celine Gounder, we thank you very much. And please know, if you want to wear your mask, you can still do that. Thank you.